Hello everyone. Today we are going to discuss MCQs on the topic of air quality and ventilation. It is an important topic as air quality play a vital role in controlling airborne and droplet infections in healthcare and other settings. So question number 1. Why is ventilation important in infection prevention and control? We have 4 choices. A. To reduce energy consumption. B. To improve the scent of indoor spaces. C. To dilute and remove airborne contaminants including infectious particles. And D. To help patients sleep better. We are going to wait for a few seconds to check the answer, and the answer is C. To dilute and remove airborne contaminants including infectious particles. Question number 2. What does HVAC stand for in a healthcare facility context? A. High volume air circulation. B. Heat and ventilation air compressor. C. Heating, ventilation and air conditioning. And D. Hospital ventilation and air control. And the answer is C. Heating, ventilation and air condition. Question number 3. Negative pressure rooms are used for A. Patients with environmental allergies. B. Immunocompromised patients. C. Airborne infection isolation for disease such as TB, measles and varicella. And D. Physical therapy sessions. And the answer is C. Negative pressure rooms are used for airborne infection isolation for disease such as TB, measles and varicella. Question number 4. Which of the following airborne pathogens requires a negative pressure room? A. Influenza. B. Norovirus. C. SARS-CoV in aerosol generating procedures. And D. MRSA. And the answer is C. SARS-CoV especially in aerosol generating procedures. Question number 5. What is the function of HEPA filters in healthcare ventilation systems? A. To heat or cool the air. B. To remove moisture. C. To trap airborne particles including bacteria and viruses. And D. To add oxygen to patient rooms. And the answer is HEPA filters are used to trap airborne particles including bacteria and viruses. Question number 6. What is the recommended number of air changes per hour in airborne infection isolation rooms? A. 2 air changes. B. 6 air changes. C. 12 air changes. And D. 20 air changes. And the answer is 12 air changes are required. CDC recommends at least 12 air changes for new construction renovation and minimum 6 air changes for existing rooms. Question number 7. Positive pressure rooms are used to A. Keep contaminants inside the room. B. Ensure air flows into the rooms from hallways. C. Protect immunocompromised patients by keeping contaminants out. And D. Filter water supplies. And the answer is C. Positive pressure rooms are used to protect immunocompromised patients by keeping contaminants out. Question number 8. Which of the following helps improve indoor air quality in healthcare settings? A. Closing all windows and doors permanently. B. Using scented candles. C. Increasing ventilation with outdoor air. And D. Turning off HVAC at night. And the answer is C. To help improve indoor air quality, we need to increase ventilation with outdoor air. Question number 9. Airborne infection isolation rooms should be tested for negative pressure. A. once a year, B. after each patient discharge, C. daily or continuously depending on local policy, and D. only after an outbreak. So answer is C. Airborne infection isolation should be tested daily or continuously depending on local policy. Question number 10. Which of the following best describes the role of ventilation during an airborne infectious disease outbreak such as TB or COVID-19? A. It eliminates the need for PPE. B. It can reduce the concentration of infectious aerosols in the air. C. It replaces the need for surface cleaning. And D. It only applies in operating rooms. And the answer is B. The role of ventilation during an airborne infectious disease is that it can reduce the concentration of infectious aerosols in the air. And that's all for today. Thank you for joining me.